Is your skin trying to warn you about something serious happening inside your body? As we grow older, our skin doesn't just wrinkle and age. It becomes an early warning system, sending urgent messages about our internal health that most doctors never mention during regular checkups. These subtle signals could be the difference between catching a serious condition early or discovering it when it's already advanced. Research from leading medical institutions has revealed that specific skin changes and sensations in people over 60 can be the first indicators of dangerous health problems developing silently within the body. That's right. What you might dismiss as normal aging could actually be your body's desperate attempt to alert you to something that could be shortening your life right now, without you even realizing it. In today's video, we'll reveal 4 critical skin warning signs that medical researchers have linked directly to serious health conditions in seniors. Each of these signs tells a specific story about your internal health, from your circulation and organ function to hidden inflammation and dangerous cellular changes that could be occurring beneath the surface. These aren't random symptoms. They're documented warning signals that deserve your immediate attention. By the end of this video, you'll know exactly which skin changes should prompt a conversation with your doctor and what simple steps might help address the underlying causes before they progress to dangerous levels. So stay with us until the end. This information could potentially add years to your life by helping you catch problems at their earliest, most treatable stage. If you're new here, make sure to subscribe and turn on notifications so you don't miss any of our potentially life-saving health information. Let's begin. Number 1. Sudden changes in skin temperature without explanation. One of the most overlooked yet telling signs of serious internal health problems is unexplained changes in skin temperature. Areas that feel unusually cold or hot compared to surrounding skin without any obvious external cause. Many seniors notice these temperature variations but dismiss them as nothing important, when they could actually be signaling dangerous circulatory or neurological issues. Medical research has established that older adults who experience patches of noticeably cold skin, particularly on the lower legs, feet, or hands, may be suffering from peripheral artery disease, a serious circulatory condition where narrowed arteries reduce blood flow to your extremities. This reduced circulation doesn't just affect comfort. It represents a major risk factor for heart attack, stroke, and tissue death that could lead to amputation. Consider William and James, both 75 years old. William stays active with gardening, monitors his cholesterol, and maintains healthy circulation. James, however, has started noticing that portions of his feet and lower legs often feel unusually cold, even in warm rooms. He's tried warmer socks and even a heating pad, but certain areas remain persistently cold. What James doesn't realize is that this temperature change could be his body's way of alerting him to dangerous arterial blockages developing throughout his body. When blood vessels narrow due to plaque buildup, the reduced blood flow creates these cold patches on your skin. The concerning aspect is that the same process causing these temperature changes in your extremities is likely occurring in blood vessels throughout your body, including those supplying your heart and brain. This makes these cold spots potential early warning signs of much more serious cardiovascular events. Conversely, unexplained hot spots, areas that feel warmer than surrounding skin without redness or obvious inflammation, can signal other serious conditions, including hidden infections or metabolic disorders like prediabetes that affect how your body regulates temperature at the cellular level. The encouraging news is that circulatory problems can often be improved through early intervention. Medications that improve blood flow, targeted exercise programs designed specifically for peripheral artery disease, and dietary changes can significantly enhance circulation and sometimes even reverse early arterial narrowing. If you've noticed persistent cold or hot spots on your skin that don't have obvious external causes, don't dismiss them as simply part of aging. These temperature changes could be valuable early warnings about your cardiovascular health that deserve professional evaluation. Number 2. Unexplained bruising or purple spots. When seniors begin noticing bruises appearing without remembered injuries or small purple spots developing on their skin, particularly on the arms, hands, or feet, many assume it's simply thin aging skin or minor trauma they don't recall. However, dermatologists and hematologists have identified these seemingly minor skin changes as potential indicators of serious blood disorders or medication effects that could have life-threatening implications. Medical evidence shows that older adults who develop frequent unexplained bruising or persistent small purple spots, called petechiae or purpura, may be experiencing problems with blood clotting. Platelet function, or blood vessel integrity, all conditions that require prompt medical attention and can signify much more serious underlying health issues. Consider Martha and Doris, both 78 years old. Martha takes appropriate medications, has regular blood work, and rarely experiences unusual skin changes. Doris, however, has been noticing increasing numbers of bruises on her arms and hands, even though she doesn't remember bumping into anything. She's also developed small purple dots around her ankles that don't fade when pressed. She's dismissed these as normal aging skin. But these changes could be her body signaling dangerous blood abnormalities or medication interactions. These skin changes occur because of problems with platelets, cells that help blood clot. Blood vessel fragility, or effects of certain medications that alter blood's clotting ability. The danger extends far beyond cosmetic concerns. These same mechanisms that cause visible bruising or spots could potentially lead to dangerous internal bleeding or clotting disorders that might result in stroke, pulmonary embolism, or other life-threatening events. Unexplained bruising or purple spots typically have distinctive characteristics. They often appear without remembered trauma, may be more numerous than typical aging-related bruising, and tend to develop in specific patterns or locations. The purple spots in particular are significant because they represent small amounts of blood leaking from capillaries under the skin. The good news is that many blood disorders respond well to treatment when caught early. Simple blood tests can identify platelet problems, clotting disorders, or medication effects. Adjustments to medications, nutritional approaches supporting blood vessel health, and specific treatments for underlying conditions can often resolve these skin manifestations while reducing more serious risks. If you've noticed increasing unexplained bruises or purple spots developing on your skin, particularly if they're numerous or appear in patterns, these changes warrant prompt medical evaluation. They could be providing crucial information about your blood health that shouldn't be ignored. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 3. Velvety dark patches in body folds when older adults discover dark, velvety patches of skin developing in body folds, like the neck, armpits, or groin area. Many assume it's simply a cosmetic issue related to aging or perhaps a minor fungal infection. However, endocrinologists and dermatologists recognize this specific skin change, called acanthosis nigricans, as a potential red flag for dangerous metabolic conditions, particularly insulin resistance and prediabetes. Medical research has established that these distinctive velvety patches often appear before other obvious symptoms of metabolic syndrome or diabetes develop, making them valuable early warning signs of conditions that significantly impact longevity and quality of life if left unaddressed. Consider Patricia and Susan, both 68 years old. Patricia maintains a balanced diet, checks her blood sugar periodically, and has healthy skin. Susan, however, has noticed darkening patches developing on the back of her neck and under her arms. The skin feels slightly thicker and has a velvety texture unlike normal skin. She's tried various creams thinking it might be a rash or age spots, but the patches persist and seem to be slowly expanding. What Susan doesn't realize is that these skin changes could be her body's way of signaling serious insulin resistance, a condition where cells don't respond properly to insulin, forcing the pancreas to produce excessive amounts. This metabolic dysfunction doesn't just cause skin changes. It's a major precursor to type 2 diabetes and significantly increases risks for heart disease, stroke, and other age-related conditions that can dramatically shorten lifespan. These velvety patches occur because high insulin levels in the bloodstream can stimulate skin cells to multiply abnormally in certain areas. The concerning aspect is that while these changes are happening visibly on the skin, similar damaging processes may be occurring invisibly throughout the body's organs and blood vessels. The distinctive characteristics of these patches include their velvety texture, darker color than surrounding skin, and typical locations in body folds. They often develop gradually and may be accompanied by other subtle signs like increased thirst, fatigue after meals, or slow-healing cuts and scrapes. The encouraging news is that insulin resistance is highly responsive to early intervention. Targeted dietary changes reducing refined carbohydrates, specific exercise programs designed to improve insulin sensitivity, and sometimes appropriate medications can dramatically improve metabolic health and often cause these skin changes to fade as insulin levels normalize. If you've noticed dark, velvety patches developing in body folds, don't dismiss them as merely cosmetic concerns. These distinctive skin changes could be providing crucial information about your metabolic health that deserves professional evaluation, especially given their connection to conditions that significantly impact longevity. Number 4. Sudden changes in moles or new skin growth. After 60, most people know to watch for changing moles as potential skin cancer warnings. But few realize that sudden changes in existing moles or the appearance of new skin growths after age 60 carry special significance. Dermatologists and oncologists have identified specific patterns of skin changes in seniors that warrant particular attention, as they may signal not just skin cancer but sometimes internal malignancies or immune system dysfunction. Medical evidence shows that when older adults develop new moles after 60, when mole formation typically stops, experience sudden changes in long stable moles, or develop unusual skin growths. These changes sometimes correlate with internal disease processes that might not show other symptoms until much later stages. Consider Richard and Edward, both 74 years old. Richard has regular skin checks, protects his skin from sun damage, and maintains awareness of his existing moles. Edward, however, has recently noticed that a mole on his back that had been stable for decades has suddenly begun changing color and texture. He's also developed several new dark spots on his abdomen that weren't there months ago. He's assumed these changes are just part of aging, but they could potentially signal something much more serious. These skin changes occur because internal disease processes sometimes trigger abnormal cell growth or immune responses that manifest on the skin. The concerning aspect is that these visible changes might be the earliest detectable signs of serious conditions developing elsewhere in the body, offering a valuable window for early intervention. Sudden changes in previously stable moles typically involve color shifts, especially darkening or developing multiple colors. Border irregularities, size increases, texture changes, or new symptoms like itching or bleeding. New moles appearing after 60 deserve special attention because natural mole formation largely stops after middle age, making late-appearing moles more suspicious. Additionally, certain distinctive skin growths like sudden seborrheic keratosis, particularly when numerous, specific rashes, or unusual pigmentation patterns have been identified as potential cutaneous markers, sometimes associated with internal malignancies or systemic diseases. The good news is that many cancers and other serious conditions are highly treatable when caught early. Regular comprehensive skin examinations, photographic tracking of existing moles, and prompt evaluation of new or changing skin features can identify concerning changes at their earliest, most treatable stages. If you've noticed sudden changes in long stable moles or the appearance of new pigmented spots after 60, these changes warrant professional evaluation. They could be providing crucial information about your health that extends far beyond skin-deep concerns. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Final thoughts now that you've learned about these 4 critical skin warning signs that could signal serious health concerns. Take a moment to reflect. Have you noticed any of these changes recently? Temperature variations, unexplained bruising, velvety dark patches, or changing moles might seem like minor cosmetic concerns. But as we've discovered, each could be revealing crucial information about your internal health that might literally save your life. From circulatory problems revealed through cold spots to blood disorders manifesting as unexplained bruising. From metabolic dysfunction showing itself through velvety patches to potential malignancies signaling their presence through changing skin features. Your skin serves as a remarkable window into your internal health status. The most empowering aspect of this knowledge is that identifying these changes early provides opportunity for intervention when conditions are most treatable. Each warning sign offers a chance to investigate potential issues before they progress to more dangerous stages. This proactive approach to health can make all the difference in maintaining independence and vitality in your senior years. Simple steps can make profound differences. Regular skin self-examinations in good lighting, photographing concerning areas to track changes over time, maintaining proper hydration and nutrition to support skin health, and promptly sharing any unusual skin changes with healthcare providers can all contribute to earlier detection and better outcomes. If any of these warning signs sounded familiar, consider it valuable information guiding you toward better health, not a reason for panic. Schedule an evaluation with a healthcare provider who can properly assess these changes. And if none of these signs currently affect you, you're now equipped with knowledge that might help you or someone you care about recognize these warning signals immediately if they appear. Because ultimately, our goal isn't just extending life. It's ensuring those additional years are lived with vitality, comfort, and independence. Understanding and responding to your body's early signals, particularly these subtle skin changes, is one of the most powerful ways to protect your health and longevity. Thank you for joining us today. We'd love to hear from you. Leave a comment sharing one insight you gained from this video and how you plan to use this information. Your thoughts matter tremendously to us, and your engagement helps shape our future content. If you found value in today's discussion, please like, subscribe, and share with someone who might benefit. Your support makes it possible for us to continue providing information that could truly make a difference. Thanks for watching, and we look forward to connecting with you in our next discussion.